Hello, my name is Rosalinda DRC. I am representing the opiates health crisis in the state of Alabama. The opiate epidemic in the state of Alabama basically connected to two first problems that the society is dealing with today. The drugs prescribed in natural form, such as codeine and morphine, that are obtained from opium poppy plant. Some other types, including heroin, oxycodone, also named as synthetic opiates, as painkiller. The opioid epidemic in the state of Alabama is basically tied in two central problems. The first issue was a significant increase in opioid painkiller prescription that started during the year of 1990. Healthcare providers started prescribing opioid to an individual for a pain reliever, not knowing the health risks, overdose addiction, and abuse of some years prescription. The second problem is lack of health system and health care medical doctors engage some patients and provide them with opioid as pain treatment that will affect the individual health later in his or her life. The health issue affect the impact of this health issue on the community, the importance of health issue to know. Drug overdose from prescription opiate is leading cause of death than motor vehicle accident in the state of Alabama. Clonidine is a form of opiate, can cause drowsiness, sedation, hallucination, euphoria, and with a higher doses. It can affect some people with the attention deficit and hyperactivity. Also, the impact of clonidine opiate substance abuse problem in the community or the younger generation addiction will use opiate as pain reliever. The most important to know about the prescription opiate in a different variety that opiate abuse damage on almost every vital part of the human body. It is harmful to a liver, specifically combined with opiates and Motrin. It can also cause brain damage due to hypoxia causing by, from lung damage or lung disease. Public health policy, who will affected by this policy? The health policy and the health issue. What will change by passing the policy? The policy will affect the health insurance company because they will not permit to bill the patient more or less addicted drug or prescription opiate under a new strategy. The healthcare organization will be more restricted to prescribe a patient with high quality medication. The outpatient or inpatient individual will have financial impact of paying the lower cost or higher price for his or her prescribed medication. The new bill will take out the financial incentive for some patients who choose the cheaper or generic prescription, but some will abuse their medication and become addicted to the new version of drugs. Therefore, some individual that is addicted to the prescription opiates will turn to heroin when their prescription run out. And that is critical health issue in the United States. The, a pharmaceutical company proposed an evidence to direct the attention to the cause of opiate abuse to the U.S. healthcare system. It creates the financial perception to promote abuse deterrent drugs to improve nation's health. The costs and benefits of the policy, the risk of enhancing or enacting the policy, the lives and health of the people, and the effect changes of the policy. The cost and benefit of the policy will help many patients. Healthcare intervention consider cost effective if a treatment costs less. The goal of addiction treatment is to decrease addiction and improve health to the citizen in the state of Alabama. The U.S. Food and Drug Administration established some procedure for the pharmaceutical company on a risk management operation for a drug biologic products, and the state of Alabama follow. The lives and the health of the people, specifically the younger generation, will changes in the health policy will benefit health plans by decreasing the potential health and economic risks related to prescription use of people prescription use of drugs for the people using these drugs. Legislative voting behaviors. Information policy affect voting behaviors of legislation. The important message legislators need to hear. The constituent voting for policy, adopting the policy. By reducing the risk of misuse and abuse of opioid medication can point out the essence of the patient result. Lower cost to health company and patient. It will complicated to know who will support this policy because the conservative and the liberals have a different point of view when it comes to establishing health policy. The essential message for legislators need to hear about these policies to educate providers, patients, and families to prevent opioid abuse and hold the physician responsible or medical team for administering opiate drugs so the patient knows the risk of drugs addiction. I am very optimistic that constituents of the legislature will vote on this policy because the government focuses on the crisis of opiate drug abuse, heroin, even though many people abuse cocaine, individually crack. President Trump has announced the opioid epidemic a top priority, and the Department of Health and Human Services helping the president's commitment to ending the opioid crisis in the United States. Recommendation: assist health provider with tools and resources to help patient treatment, educate patient and family members the risk of opiate addiction, supplying all medical doctors with tools and some resources that are essential to benefit in providing pain management to the patient, provide policy and procedures to authorize the use of opioids for chronic pain, and help by the physician to keep safe care and treatment to save patients' life, provide online training for the medical team, patient and family members, and the use of the critical, safe, effective pain management option with their healthcare provider. Let's conclude my briefing.